Hello everyone, welcome back to Medical Coding Club. This is Chandrika. So as requested, today I am going to review one more urgent care ENM visit live chart. So in this live chart, you're going to learn how to take appropriate ENM level based on medical decision making, and also how to assign appropriate procedure code by reading the procedure note, and also the relevant diagnosis codes and the modifier required for the visit, okay, and the place of service. Everything you are going to learn step by step. So please do watch video till end. And if you are not subscribed to my channel, please do subscribe. And I have also explained a lot of other concept, I have explained many concept live chart, and also the CPC related concept. So you can check my channel once, and if you like it, you can subscribe to my channel and you can share with your friends. Okay. And before we start, my new CPC training batch will be starting from August 3. If you are interested, you can either WhatsApp me or you can enroll on my website. Okay, and fees will be only 7,999, including study material. Okay, and duration will be 2 months, which will be very effective. You are going to learn all the chapter of ICD, all chapter of CPT effectively, along with the modifier compliance and the necessary things that you need to pass for CPC exam. Okay, so if you cannot offer any traditional training fees, definitely you can consider my course. So yes, let's begin. So as you can see, it's urgent care visit. So as I already said, urgent care is also part of outpatient setting. Okay, and what is the difference between our normal office visit versus urgent care facility means? Urgent care is usually, it's an actually type of uh, like outpatient, as I mentioned. The difference is that urgent care focuses on immediate and unscheduled treatments. Okay, all unscheduled treatments will be treated with urgent care setting, while in the regular office or outpatient clinic, the providers will schedule, or they'll see the patient with an appointment, or the routine follow-ups, okay, or preventive visits. Likewise, you will be seeing under office visit. Okay, that's why we call this as urgent care facility or setting. And we do have a particular place of service code that I'll explain later. And then whenever we are talking about evaluation and management, the first thing that you're going to see is whether this patient is a new patient or established patient. Okay, that is your first thing. So here, as you can see, patient status is established. And when you're actually working in the software, we will be able to see the patient visit history. And by seeing visit history, we will understand whether this patient belongs to new patient or established. Okay, since here we do not have the software access, I have directly mentioned patient as established patient. Okay, so this is the first thing that you will identify with the ENM code. And also setting. The setting is urgent care, which belongs to outpatient, as I already mentioned. Okay, then the second thing what you're going to see is you're going to check the provider signature in the medical record. Okay, so provider signature should be there. So if signature is not there, it will create a compliance issue. Okay, the meaning of not signing, or you're not seeing the signature of the doctor who have rendered the service, means it's like he has not given a proper authorization, or he is not acknowledged the medical report. Okay, that's why we first need to check whether the doctor has signed the report or not. So nowadays it will be in electronically signed. Okay, at least the electronically signed thing will be, for us it will be helpful to understand, yes, this report was the provider has gone through this report. Okay, that is what signature refer. Then coming to chief complaint here. Chief complaint is follow up on back pain and bilateral ear pain. Okay, so and also sorry, in middle I may get cough because I'm suffering from this chronic cough from long time. Since I have a lot of teaching schedule, it has been very hectic for me. So in middle I'm taking some pauses. So do not think that like do not lose your interest. Okay, because I'm going to explain so many things in middle. Since I'm getting cough, I'm feeling like let me pause. So if I'm keep thinking all of these things, I'll definitely I cannot make any videos. So I'm just, I'm just whatever you think I cannot really help. So my problem is my problem, right? So yeah, coming back to chief complaint, follow up on back pain and bilateral ear pain. So this is the chief complaint. That's why patient is here, because of back pain and bilateral ear pain. Then you have history of presenting illness, HPI. So under HPI, you should make an habit of reading the complete lines that given under HPI, because there is so much information under HPI, because it is the patient is going to give more details about his symptoms. So as you can see here, John Smith, 32-year-old established patient who presents on urgent care with a complaint of low back pain and bilateral ear pain. Okay, so if you observe chief complaint, here they only said back pain, but under HPI, the patient is stating that he is having low back pain. Okay, so there is more specificity here. Okay, and same way, he also has bilateral ear pain and he reports fullness in both ears with a decreased hearing. Okay, so bilateral ear pain, and he also reports there is a fullness of both ears and decreased hearing. Okay, there is a hearing kind of, he is what to say, decreased hearing means he is not hearing properly, not able to hear properly. Okay, why? Because that provider will examine and then he will identify what is the cause. That we will see in the later portion. Okay, then he denies ear drainage, dizziness, nausea, vomiting. So he do not have all of these. Okay, because he's not reporting, he's denying all of these symptoms. Okay, you cannot consider whatever he like he say denied. So almost these are all not exist in patient body. Only what he says reports that you can consider. Then current medication, he is taking ibuprofen. Allergies, no known drug allergies. That means the person is not having any like known drug allergies. He is not allergic to any particular drug. Currently, he is taking ibuprofen. Then past medical history, he had allergenic rhinitis, no prior surgeries. Family history, they have given some history about the family. Social history will always be there. So you can see he was never a smoker, but occasionally he takes alcohol use. Review of system, ROS. Under ROS, you can see all the systems, and the systems, whether reports or patient denies, they'll specify. So you can just see here some information about all systems are there that you can pause and read. Then vital signs, it will be there with all the patient medical record. So they'll record BP, pulse, respiration, temperature, okay, and O2 saturation, everything they'll record. Then comes to physical examination, PE. Okay, so under PE, again you're going to see the organs, particular organ, and if any abnormalities are there. So for example, under ears, so you can see they have mentioned that external ears are normal, bilateral external auditory canal completely obstructed with a dense impacted cerumen. Okay, impacted cerumen refers to cerumen is nothing but wax in the ear. Okay, so wax will be there. It's like, what to say, it will be like waxy in nature. For lubrication purpose, it will be there. Okay, it will have its own function. But what if it becomes tight and formed in a tight formation, okay, where it is not even moving, like it has built in a particular what to say, like it got too much earwax in the patient ear, and that caused hearing loss or decreased in hearing, not completely hearing loss, but decreased in hearing. Okay, that is what impacted cerumen refers to. And then on right ear also there is impacted cerumen, and left ear also there is a impacted cerumen. Okay, so now we need to check what else: nose, mouth, neck, lungs, heart, and neurological. So here also they have said that patient is having mild low back pain. So while coding diagnosis, you must code mild low back pain code and not the low back unspecified code. Okay, because here you have the clarity that they said they specified it's a low back pain. So that I'll show when we are coding the diagnosis. Then coming to procedure note, you have a removal of bilateral impacted cerumen. Procedure being performed is removal of bilateral ear impacted cerumen. Then use what things they have used for procedure. You can see right ear cerumen impaction was removed using curate. Okay, so the curettage is used, so it's an instrumentation. So whenever they are removing impacted cerumen using curettage or instrumentation, you have one particular code. And same way, whenever they are removing cerumen impaction or impacted cerumen using irrigation, you have another code. So in our procedure note, you can see that for both ears, right and left ear, they have used instrumentation. So you must code cerumen removal using instrumentation code. Okay, and also they have said that following instrumentation, okay, a small amount of residual loose cerumen remained within the canal and was gently removed using warm water irrigation. So they again said some portion, some left out portion was removed using irrigation. Irrigation is nothing but using water. They're going to, flush out that remaining portion or remaining whatever left out wax is there, that they're going to flush out. Okay, that is what irrigation method. So remember, so I'll also show the code set. So you have two codes, right? One code is 69209. It says removal of impacted cerumen using irrigation unilateral. Okay, and the same way 69210, removal of impacted cerumen requiring instrumentation. Okay, so in our procedure we had instrumentation for both ears, so I should code 69210 as my procedure code. But a few coders think since there is also irrigation documentation, I should also code 69209. Okay, which is wrong. Why? Because if you see this, do not report 69210 in conjunction with 69209 when performed on the same ear. Okay, on the particular ear, it could be right ear or left ear. On that ear, if they are performing cerumen removal using instrument as well using irrigation, means you cannot code irrigation code. You will just code only one code, which is instrumentation code. Okay, but in case if they perform right ear cerumen removal using instrumentation, left ear using irrigation, means that time you can code 69209. Okay, because ear is different. Left ear, one was right, one was left. In this case, you can use 69209. Okay, so now 69210 and 69210 69210 and 69209 will be coded only when they are in two different ear, not the same ear. Okay, so for this we have to use modifier 59. So we will code that only if they are in two different ear. But as of now, in our question, it was only both ears they used instrumentation and not the irrigation. So you just have to ignore the irrigation. Okay, and code for only instrumentation. 69210 will be coded. Okay, this code. 69210 will be coded for this medical record as a procedure code. Okay, then comes to assessment. What is assessment? The patient had back pain. So here you can see provider just picked back pain. But throughout the record you have seen patient is having low back pain. Okay, so the specificity should be, it is there and it should be coded. So whenever I am going to code the diagnosis, I will add low back pain. Then bilateral impacted cerumen is there. That will also be coding because there is a medical necessity. Since they have removed cerumen, this impacted cerumen code should be assigned for that procedure code. Then coming to plan, like check the medication what they are using. So they told continue acetaminophen over the counter as needed, and also ibuprofen 600 mg orally every 6 to 8 hours for low back pain. Okay, two medication. One was over the counter OTC, another one it is also ibuprofen is also OTC, but since they mentioned 600 mg, so if you check the drug website, more than 400 ibuprofen, it goes to human prescription drug. Okay, that means prescription drug, so that you will consider this as RX management, prescription management. This one is OTC, one is prescription management. Okay, so two drugs are there. Now, yeah, that's it. There is a signature. Okay, now let's find out our ENM level code. Okay, so as you know, ENM level, to find appropriate ENM level, either you can follow MDM or you can follow time-based coding. But as you can see, throughout our medical record, we were not able to see any time here. So you have to go with our default method, medical decision making. To code medical decision making, you need to check what is your problem, what is the problem being addressed, what are the data points, and what is the risk management. Okay, so now problem. So firstly, we will see problem being addressed. So problem being addressed, as you can see, there is only back pain, low back pain, and bilateral impacted cerumen. Okay, both of these conditions falls under acute uncomplicated illness. Okay, acute uncomplicated illness. So if you want to see acute uncomplicated illness, okay, comes under low. So your problem addressed level is low. Okay, so it will be low. And then if you check the data points other than procedure, you're not seeing any labs, you're not seeing any independent historian point, you're not seeing anything diagnostic. Okay, no external notes reviewed, nothing like that. So your data will be minimal or none. Okay, no points for data. Then coming to risk management, as you can see, there was two drugs. One was OTC drug, another one was prescription drug management. Okay, so since you have one prescription drug, so you consider there is a RX management. And as you know, RX comes under moderate. Okay, prescription drug management. So moderate. Okay, so now you will use your risk as moderate. Okay, risk as moderate. So now, as you all know, you will take only two levels, two components which meet or exceed. Okay, in this you are getting all three in a different level. So you're going to choose the average MDM level. Okay, you cannot choose the least one, you cannot choose the highest one, and there is a level that is giving you average, that is low. So your total final MDM level will be low MDM. Okay, low MDM. So for low MDM, established patient, urgent care or nothing but outpatient office visit code will be 99213. Office or other outpatient visit Okay, low medical decision making. Code will be 99213. This is your ENM code. Okay, and if you want to check if you're not understood, if you want to check with the calculator also, so I'll just check. Okay, so office or outpatient, patient is established. Okay, so 1 minute. So see here, now I already told you, we had acute uncomplicated illness, and then coming to data points, data was 0. Okay, so I'm going to select minimal or none. Then coming to procedure, which is risk. So we had prescription drug management. Okay, so that's it. So I'm going to see here. Already I got MDM as low. Okay, low MDM. And if you can once again check, code will be 99213, low complexity. Okay, this is your ENM level code. That's it. Now, if you want to check for ICD, we had cerumen removal code. So cerumen removal code will be 1 minute, not H61. Sorry. Okay. H6121 impacted cerumen right ear, 22 left ear. Okay, but we have bilateral impacted cerumen. So when we have bilateral code, and our documentation is also for bilateral, you should not split and you should not code them like right and left ear. Okay, you should always go with bilateral code. H6123 will be coded. And then for low back pain, you can code low back pain unspecified. Okay, M5450 will be coded. Okay, these are the diagnosis codes. So now we'll code with the surgical ticket. Okay, so here you can first check. So it's a dummy ticket. Okay, so I have not made any changes, just for your reference I'm using. So here you can keep your actual date, then facility. Here facility is urgent care. Okay, urgent care. So for urgent care, what POS we will get? POS for urgent care will be 20. Okay, see, 20 will be your place of service, so that you're going to use 20. Then coming to CPT codes, the first CPT code should be ENM code. So we got 99213 as our ENM level, and then we got another code 69210. Okay, cerumen removal using instrumentation. And for this diagnosis, for ENM you can code both the diagnosis. Okay, you can link. Say for example, 1 was low back pain, 2 was bilateral cerumen, impacted cerumen means 1 2. Okay, these are the what to say, like linkage. Okay, pointers. So what I can do, 1 2, both 1 2 I'll code. That means ENM level evaluation was done for low back pain also, and bilateral impacted cerumen also. Okay, that's why I'm using 1 2 both. Then coming to procedure 69210, here diagnosis should be used only for an appropriate medical necessary code. Okay, 69210, which the procedure was done. What was the main reason to perform 69210 is impacted cerumen. Okay, so that you have to only code that impacted cerumen code, whatever two in this two what we have listed at 61213 means 23 means that will be coded, okay, in the diagnosis position. You cannot use low back pain with 69210 code because they are nowhere relevant. 69210 why they have performed? In order to remove the impacted cerumen, so that diagnosis only should come here. Okay, now they are they are meeting the medical necessity criteria. Then comes to modifier. So you know that modifier, whenever you have a ENM, along with that, if you have separately identifiable procedure, you will give modifier 25. Okay, there is a procedure as well, there is a evaluation and management. So that you need to code 25 modifier with ENM. Then comes to 69210 was performed bilateral. Okay, 69210 procedure was performed bilaterally. So you can use modifier 50. Okay, modifier 50 says bilateral procedure. Okay, this is how you will be used. And like as you can see, 69210 code contains information as unilateral. In this case, 69210, instead of unilateral, if you had bilateral information, you should not take 50 modifier with 69210. Okay, because code itself has a bilateral meaning. That time no need to use modifier 50. Since we do not have that information, you can use modifier 50. See, for bilateral procedure, report 69210 with modifier 50. Okay, it is acceptable. So I can use modifier 50. And coming to quantity will be 1, 1. Okay, one time only we are reporting. And here 69210, it will be doubled. Okay, because we are using 50 modifier. So it will be automatically, it will get double. Okay, so we have a lot of pair policies based on what pairs requires. If they want to split and code, you need to code 69210 like RT, 69210 LT. Like in 2 line item also we can code. So that depends on the like the policy of the payer. Okay, that they'll teach. Once you start coding for the particular project, they'll help you with all the basic understanding on how the provider or the payer request. Okay, the billing guide will be provided. So far, this is how you will code the ENM along with that procedure and appropriate place of service, appropriate modifier usage, and also the diagnosis code. Okay, in the first position, you can keep M54 point, 1 minute, low back pain M54.50. Same way, the second position, H61.23. These are the diagnosis codes. These are the procedure codes. Okay, this is an ENM code. And place of service is 20. Modifier we have used 25 and 50. Okay, this is how you need to code. So that's all. So always make sure to give and select appropriate ENM level for your visit and understand what is the procedure given. Okay, always read your medical record completely so that you will get proper details about the patient condition. Always look for the provider signature. Always try to code specified codes, even though a doctor is choosing unspecified codes. If you have documentation, like how we had a low back pain, okay, so that kind of specificity you can look for in your record. Okay, so yes, that's all. I hope you got some idea on how to code ENM visit in real time. Okay, and if you are interested for the CPC course, please do text me on WhatsApp, or you can either enroll on the website. And if you have already taken the course and if you're preparing for CPC exam, I used to conduct CPC revision batches, but now since many of the people are doing the same thing, and I lost interest because and also so many are selling so many papers and all, so I lost interest in that because it's not worth of keeping such efforts. when someone is doing some wrong practices, people may, they don't want to learn. They simply they'll ask me, give me the paper. Okay, so if you are only genuinely, if you want to learn for a dedicated time, okay, if you can join for revision also. For CPT classes alone you can attend, and you can pay for CPT classes alone. Okay, and if you want CPT or ICD class recordings, you can purchase that also. And there are a lot of good resources on my website that also you can check. And if you need, you can purchase like CPC mock papers and ICD interview materials. All those is already listed. You can once visit. Yeah, that's all. Please do follow me on Instagram so that you will get a lot of resources, because daily basis I'll be posting a lot of resources. Yeah, that's all. Please do subscribe to my channel, and like I'll try to cover many more concepts in future if time permits. Thank you all. Thank you for watching.